Insomnia is a sleep disorder that is characterized by difficulty falling or staying asleep. There are two types of insomnia: primary insomnia and secondary insomnia. Primary insomnia means that a person is having sleep problems that are not directly associated with any other health condition or problem. Secondary insomnia means that a person is having sleep problems because of something else, such as a health condition, pain medication they are taking, or a substance they are using like alcohol.
The issue in insomnia, one of the common mistakes patients think about is the quantity of sleep. The most important thing also to think about it is the quality of sleep. Is there any change in the quantity of sleep? Usually I'm sleeping 8 hours, now I'm starting to sleep, my doctor, 5 hours. This is quantity. But what about the quality of sleep? Sometimes you are sleeping 8 hours, still you are sleeping 8 hours, but the quality of sleep not refreshing during the day. This is again is an insomnia disorder. Then, insomnia either early or intermediate or late insomnia. Early difficult to go to sleep. Intermittent sleep or intermediate insomnia is interrupted sleep. Late insomnia, when the patient awake earlier, which usually happen in psychotic depression or even not psychotic, even major depressive disorder, and this is the old explanation of that disorder. One of the main symptoms is late insomnia.
It's a persistent pattern of problems in falling asleep or maintaining the adequate sleep. If we have such type of impairment, we put the diagnosis of insomnia.
Insomnia disorder would be when somebody's experiencing difficulties with sleep and disruption to sleep. So, for instance, a person may have a typical time they go to sleep at night, and they may be finding that it's taking too long to actually go to sleep. So maybe just lying on the bed waiting to go to sleep, feeling like that's taking forever, whereas most people maybe just drop off to sleep within about 5 to 10 minutes of hitting the pillow. And people with an insomnia disorder may find that it takes perhaps longer than half an hour, perhaps an hour, and they feel that they're just lying there and not, sometimes not tired, sometimes they are tired but still can't manage to get to sleep. Another aspect of insomnia might be that you can go to sleep okay, you can fall to sleep fairly easily, but then you find that you're very wakeful at night. Your sleep is disrupted. You find that you wake quite frequently at night and perhaps can't get back to sleep easily.
Insomnia disorder characterized by inability to sleep, whatever quantity or quality, difficulty to initiate, difficulty to a continuity of the sleep. This disorder interfere and impairment physical health of these patients. This disorder, the most common disorder of sleepwalk disorders.
The diagnostic criteria we usually depends on certain type of inquiries. For example, the sleep record. We usually depends on the history. We usually depends on the data which is collected from other partner or the sleep partner, which is very important for the diagnosis of insomnia. The prime or the basic impairment is difficulty in falling asleep or maintaining adequate sleep.
What does it mean, insomnia? Insomnia, it doesn't mean that the patient cannot sleep. This is a wrong definition of insomnia, by the way. Insomnia, it means that the patient cannot continue the sleep phases. This is number one. Number two, insomnia, it means that the patient started to removed from one phase of sleep to another phase in a difficult way. This is number two. He cannot continue. He's comfortable during the sleep phases. Another thing, patient who suffering from insomnia induced mood disorders, and some of them, about 5% of them, induce substance dependence, especially they taking some sort of Narcotic, it's mean such as barbiturates. It's some sort of medication to help people to get involved into sleep, in deep sleep. And this is pattern of addiction, by the way.
Causes of insomnia. Causes of acute insomnia can include significant life stress, job loss or change, death of a beloved one, divorce, moving, illness, emotional or physical discomfort, environmental factors like noise, light, or extreme temperatures that interfere with sleep. Some medications, for example, those used to treat colds, depression, high blood pressure. Some medications, for example, those used to treat colds, depression, and high blood pressure may interfere with sleep. Interferences in normal sleep schedule, jet lag, or switching from a day to night shift. For example, causes of chronic insomnia include interferences in normal sleep schedule, jet lag, or switching from a day to night shift. Causes of chronic insomnia include depression or anxiety, chronic stress, pain or discomfort at night.
Causes for sleep disorder can be to do with stress in a person's life, maybe being over preoccupied by things that are going on in their everyday life. Perhaps there are relationship issues, difficulties, perhaps problems with work, maybe some issues to do with debt and financial problems. So general worries that may actually be preventing someone from getting to sleep, or once waking, preventing from going back to sleep. So what would stop them from going to sleep is perhaps what you call ruminating over those worries, over those concerns, and not being able to relax enough to go to sleep. Another cause of sleeping problems can be dietary as well. So when you're having an assessment for a sleeping disorder, a clinician or a psychologist may want to check out what kind of food you're eating, when you're eating it. It can have an effect on your ability to go to sleep and stay asleep as well. So things like perhaps drinking too much caffeine in the day from Coca-Cola or tea or coffee, and maybe having meals too late in the day just before you're going to sleep. That's quite difficult to sleep on a full stomach. And other things as well, like alcoholic drinks, not even necessarily just before you're going to bed, but throughout the day, can actually have an effect on your sleep and your sleep pattern.
Causes of insomnia disorder classified into biological, hormonal, psychological, and pharmacological as drugs. Drugs, or any person complaining from insomnia disorder, must be evaluated of any drugs his intake, as corticosteroids or cancer treatments, or antidepressant drugs, or drugs of hypertension or diabetes. And medical causes or medical condition that causes of insomnia disorder, as diabetes and abnormalities in thyroid function, abnormalities in hormone, abnormalities in pituitary function, and cardiological causes, and pain. Pain is the most common cause of insomnia disorder, as osteoarthritis or osteoarthrosis or lumbago, as or back pain or headache.
If we make a preview about the previous studies about sleep disorders and this sleep apnea and insomnia, we can find a relationship between insomnia and other mental disease and mental disorders. Mental disorders, it's some sort of psychological dysfunctional and emotional also dysfunctional. It's may negatively affecting in the sleep, in the person's sleep. The prevalence and the epidemiology about insomnia, it's more than 23%, especially in adulthood, more than in childhood or adolescent. By the way, geriatric, who started to be more than 65 years old, suffering from some sort of insomnia by the old age. And this is a normal result in this geriatric phase.
Sleep apnea is a very insidious disorder, starting very gradual, disturbing life, really. One of the main disorders affecting hypertension, affecting this, even there is some association with stroke, there is some association of uncontrolled diabetes, and a lot of complications, even the sudden death with the sleep apnea. Sleep apnea, how to diagnose it? It's a long way of diagnosis, but the main diagnosis through the sleep lab to specify, is there any interruption of the sleep? The patient, he lie down, he sleep maybe 8-10 hours, and he wake in the morning unrefreshing. Some sleep naps during the day, unrefreshed, so anxious, so tense, very depressive and anxious mood of that patient, unstable, as we have mentioned, of hypertension and diabetes, and maybe he's prone to different psychiatric and physical disorder.
People with insomnia have one or more of the following symptoms: difficulty falling asleep, waking up often during the night and having trouble going back to sleep, waking up too early in the morning, feeling tired upon waking. Signs, symptoms of insomnia. Symptoms of insomnia can include sleepiness during the day, general tiredness, irritability, problems with concentration or memory. If you think you have insomnia, talk to your healthcare provider. An evaluation may include a physical exam, a medical history, and a sleep history. You may be asked to keep a sleep diary for a week or two, keeping track of your sleep patterns and how you feel during the day. Your healthcare provider may want to interview your bed partner about the quantity and the quality of your sleep. Your healthcare provider may want to interview your bed partner about the quantity and the quality of your sleep. In some cases, you may be referred to a sleep center for special tests.
Hormonal causes as imbalance between imbalance in or impairment in thyroid function test as thyroxine T3 or T4 or TSH must be evaluated from psychiatrist to indicate or to resolve these problems. Psychological problems as depressive symptoms or anxiety symptoms or psychotic symptoms as schizophrenia or bipolar. The most common disorder that cause insomnia disorder is manic disorder or delusional disorder. About anyone he know about anyone harm once or another.
The main diagnostic criteria is a predominant complaint of the patient that he cannot feel any degree of satisfaction about his way of sleep and his ability to get into sleep or the quality of sleep. And we can find that there is relation or related factors with insomnia. One of them, the difficulty initiating sleep in children and in adolescents and also in adults. The continue of sleep phases. We can find also that the patient cannot continue the sleep phases, and this episode had been clearly occurred about 3 times through 3 months per week. 3 times per week through 3 months. And this is very important diagnostic criteria. Early morning waking up and the patient cannot easily get into or return back to sleep.
for the development and course, for the risk and the prognostic factor, and for the cultural related diagnostic issues. As we said, it's present in all cultures. It's usually cause significant impairment for clients. It usually affects their ability to work. It usually affects their ability to concentrate and to perform the usually acquired daily functions.
In general population, we can find that 6% to 10% suffering from or have symptoms which are related to insomnia disorder. And this pattern of symptoms or this pattern of criteria about insomnia disorder may negatively affecting as the consequence of the insomnia in the social performance and make the patient suffering from irritability in his mood, and also the patient may induce some sort of poor anger management and cannot control himself, and with impairment in his social communication skills with people around him.
For the comorbidities and the relationship with other classifications, all other psychotic, medical or psychological disturbances should always be ruled out. For the functional consequences of insomniac disorder, as we said, it causes marked impairment in clients' lives. It causes impairment in the ability to concentrate, as well as it affects the daily lives of clients, the way that they can get to perform their daily activities.
What is the main differential diagnosis which related or may involved in the diagnosis of insomnia disorder? We have several patterns of factors in the differential diagnosis in insomnia disorder. One of them is the normal sleep variation, and another one is a situational acute insomnia. Another one, delayed sleep phase during the day, and restlessness about the restless leg syndrome, and the breathing related disorder or releasing breathing related syndrome, and the parasomnia, by the way, and the substance medication which induce sleep disorder.
Treatment for insomnia. Acute insomnia may not require treatment. Mild insomnia often can be prevented or cured by practicing good sleep habits. If your insomnia makes it hard for you to function during the day because you are sleepy and tired, your healthcare provider may prescribe sleeping pills for a limited time. Rapid onset. Short-acting drugs can help you avoid effects such as drowsiness the following day. Avoid using over-the-counter sleeping pills for insomnia because they may have undesired side effects and tend to lose their effectiveness over time. Treatment for chronic insomnia includes first treating any underlying conditions or health problems that are causing the insomnia. If insomnia continues, your healthcare provider may suggest behavioral therapy. Behavioral approaches help you to change behaviors that may worsen insomnia and to learn new behaviors to promote sleep. Techniques such as relaxation exercises, sleep restriction therapy, and reconditioning may be useful.
As early the treatment of sleep apnea is very important. The CPAP, the machine patient using on his face during sleep, is the most important to give a positive pressure of air on the patient mouth and nose to facilitate for him or to overcome the obstruction happening during sleep. Is very important to be considered as one of the differential diagnoses. Sometimes the physician or even the psychiatrist will forget that one. For you as a patient, as a family member, you need to remind your psychiatrist or your physician. Yes, sometimes the family member, the very educated one, who's reading thoroughly between books, he could ask a very intelligent question, facilitate for me as a psychiatrist or a physician to think about some disorders which are the very rare type of disorders.
As far as behaviour modification programs and techniques go, within therapy and how to deal with sleep problems, you would ask somebody to perhaps keep a record of their sleep, what time they're going to sleep, how long they feel it's taken to go to sleep on reflection the next day, and also perhaps keep a record of how many times they've woke up in the night, how long did they manage to get to sleep, how long did they stay awake at night, what kind of things did you do when you actually woke up. Did you wake up and just lie in bed thinking about particular concerns or worries? Did you get up, perhaps go and make a drink, go to a different room? What was it that you did while you were awake? And other diaries as well, record keeping, perhaps things that are going on in a day, activities you're doing, are you getting enough exercise, that kind of thing. So, and behaviour modification would focus on perhaps changing some of those aspects of your life that may be contributing to your sleeping difficulties. So for instance, perhaps changing where you eat a big meal, that might make a difference. Changing what you do when you find yourself just lying in your bed trying to get to sleep. What are you thinking about? If you find you're thinking about the worries of the day you've had, or the worries that what kind of day you're going to have the next day. Perhaps trying to learn more relaxation techniques, trying to take your mind away from those concerns and just relaxing more when you're in the bed, be that through body relaxation, through breathing relaxation, or through imagery, to help actually going to sleep. And again, if you find that you're being wakeful at night, getting waking up too many times, focusing on what are you doing during that time. Are you getting up? Are you making a drink? Are you thinking about your concerns, your worries, and trying to change that? Any one of those things may be preventing you from getting a good night's sleep again.